would begin asking my patient a series of questions, like a respiratory general survey. In terms of the present health status, I would ask of any shortness of breath, any unusual cough, any sputum, when was their last mammogram, because this patient is a woman. I would ask them, in addition, do you have any chronic illnesses? Do you have any allergies? Do you have any difficult breathing during daily activities? Do you have any difficulty breathing when you sleep? And are you currently taking any oral medications for respiratory disorder? My patient has answered no to all of these. General health history, present health status. I will ask my patient, do you use an inhaler? What medication is in the inhaler? If they're using one, how often? Do they use oxygen at home? My patient has answered all no. For past medical history, I would ask, have you ever had any problems with your lungs? Have you been diagnosed with respiratory diseases such as asthma, bronchitis, emphysema, lung cancer, pneumonia? Have they ever had an injury to the chest? And some personal and psychosocial history I would ask, like if the patient smokes, or if they smoke in the past, how often did they smoke? Will you have ever tried to quit? My patient does not smoke. For family history, I would ask if there's any history of lung disease, such as tuberculosis, cancer, cystic fibrosis, asthma, or anything like that. I would also ask about their home environment, like are there any environmental conditions that may be affecting their breathing at home, any air pollutions, any allergens, type of heating, air conditioning, if they have any hobbies like woodworking, plants, metalwork, exposure to smoking of others in the home, like secondhand smoke, occupational environment, like where they work, if they work in a factory, outdoors, in heavy traffic. My patient works outside, by the water. I would also ask if my patient was exposed to irritants, if they wear a mask or a respiratory mask, do they have any special ventilations to clear the pollutions? And I would also ask about their travel history, like have they recently traveled to a foreign country or areas of the United States where they've been exposed to uncommon respiratory diseases. My patient has not traveled out of the country, especially due to COVID. I would then inspect the AP diameter, which is normal. The skin color is light pink. No cracks, no bruises, nothing like that. When they're breathing, it's pretty symmetrical. And then I would auscultate their lungs, and I'm gonna use the pillow to sort of show the locations of where I would, it's hard a little bit to hear, so I think I would have these in if I was actually doing it. And for the posterior chest wall, I would begin on the left side of the patient. Well, this is the patient, it would be the left. And I would do like a zigzag motion starting at the first, second intercostal area. And I would listen. And then down. 4, 5, 6, 7, 8. And I should sort of hear just like a whooshing sound, like the patient's breathing. And it sounds good, clear, no crackling, nothing like that. I would also check the lateral chest wall and listen. And then do the anterior chest wall. And it's about 6 points as well, starting the left side, right about the first and second intercostal. So I'd listen, move over. Oh. And there's only 6 points really for that. And that's about it. And I would have checked the lateral chest wall, which is over here. Like the lateral, it's also called like the lateral middle lobe. It's on right about here. I think I showed it right before the anterior. And that would be the respiratory assessment.